I thank the gentlewoman for yielding. Right now, today, as we all are here in the halls of Congress, our nation is facing a mental health crisis. And this crisis followed 2 years of lockdowns, remote learning, that have left so many Americans feeling isolated, lost, and in some cases, hopeless. Particularly, our young Americans feel all of these emotions. I rise today in support of this legislation that would help to address this crisis head on by helping to ensure that those who are struggling can receive the help that they so desperately need, and they need our attention to it right now. The Restoring Hope for Mental Health and Well-Being Act of 2022 expands access to care for millions of Americans, including children and teenagers who are desperately in need of this assistance. As a doctor, I've treated patients who have later lost their lives to mental illness. Just last week, we had physicians here on the Hill, pediatricians, family doctors, telling us that they have seen the shift of the pendulum, that they see on a daily basis more and more cases in their patients, specifically involving mental health. And there is not a single American who has not in some way been impacted by the effects that mental illness is having today. In the past year, over 107,000 Americans have lost their lives to drug overdoses. Far too many grandparents, far too many fathers, mothers, sons and daughters are dying. We cannot wait to act any longer. We need to act and vote on this legislation. To help address the tragedy of addiction, this bill increases support for opioid recovery programs that will help people who are struggling to receive the care that they need. This bill would go on to make mental health screenings a part of each person's annual physical exam and evaluation, and help to ensure that everyone who sees a doctor is able to have a conversation frankly, concisely, clearly about the mental health and the mental health issues that they are facing. Most important, this bill would provide a whole of care approach that would fund prevention, treatment, and recovery services for the people who are suffering with addiction. We have worked as a committee, as a conference, addressing these important issues. I urge all of my colleagues to vote to pass this important piece of legislation, and I yield back the balance of my time.